Thank you, Mr. President. I come to the floor, as I do almost on a weekly basis, to talk about the health care law. And I do that as a physician, someone who's practiced medicine in Wyoming for a quarter of a century, taking care of Wyoming families. And I come because I have great concerns about this health care law. We know history proves that landmark pieces of legislation written in Congress often contain drafting errors at one stage or another during the bill's development. And this is one of the main reasons that most landmark bills are written and negotiated in an open and a transparent manner. Writing and negotiating bills in a way helps members of Congress minimize mistakes. It helps uncover any unintentional consequences. It helps fix problems. And this is done through rigorous committee and floor debate, as well as House Senate conference committees as the bills go through the process. Most importantly, doing something in an open and transparent manner gives the American people, the folks at home, an opportunity to read a bill, to study it, to think about it, to discuss it during town hall meetings with their members, and to ask questions and weigh in. Well, unfortunately, Mr. President, we all know that the largest health care law ever enacted didn't undergo an open, transparent, or bipartisan process. President Obama promised the American people that they could watch the discussions and the writing process, he said, on C-SPAN. Well, instead, the President and Democrat leaders in both the House and the Senate sealed themselves behind closed doors. Their strategy? Pass sweeping health care legislation based on stealth and speed. Use sound bites to sell America about expanding coverage, about cutting costs, about improving quality, and then offer very few details explaining exactly how the bill would impact individual Americans, nor what it would cost the country. Well, while this entire strategy was being played out, the President and Washington Democrats were writing the legislation behind closed doors. Why? Well, to limit the time that the bills could be read and reviewed by the American public. Some in Washington thought that rushing a health care bill into law before America could read it was the perfect way to avoid public debate and public questioning. Many of us recall when former Speaker of the House Nancy Pelosi infamously said that first you have to pass the bill to find out what's in it. Well, the President passed his health care law, and the American people continue on a daily basis to find out what's in it. And they don't like it, and it's easy to understand why. As the American people have had a chance to read the details, they started asking more questions. The numbers simply weren't adding up. Health care costs they were seeing were going up, even though the President promised that health care costs would go down. There were costly mandates on small employers, and that was going to discourage hiring. Nancy Pelosi said they'd hire 400,000 people immediately. They haven't been hired. She said 4 million new workers ultimately. We haven't seen it yet. Mandates that we've seen have come out of the health care law do nothing to spur economic growth and help the 9.1% of individuals nationwide, 14 million Americans who are currently unemployed, who are looking for work. And then even more government orders forcing individuals to buy one-size-fits-all government-approved insurance or face a fine. Well, the American people have now had 17 months to find out what is in the President's health care law, and one news report after another has been uncovering a laundry list of so-called glitches in the health care law. Well, former Speaker Pelosi wanted the American people to find out what's in the law, and 17 months later, the American people are finding out that the President and Washington Democrats didn't even write it correctly. On Wednesday, September 7th of this year, Investor's Business Daily printed an article titled, "Oops, No Obamacare Tax Credit via Federal Exchanges." The article explains that the way Obamacare was written, individuals who qualify for a taxpayer-funded subsidy to buy government-approved health insurance in the new state exchanges may not get it. Section 1311 of the health care law requires the states to set up state-run exchanges. This state-based exchange is a place where individuals can use their government subsidy to buy health insurance. Now, if a state declines to set up their own exchange, then Section 1321 mandates that the federal government set it up and run it for them. Here's the catch. The health care law, as written, as signed by the president, explicitly says that the taxpayer-funded subsidies can only go to people who are enrolled in exchanges set up by the state. Nowhere does the health care law mention that the subsidy can be given to people enrolled in the federal exchange. So the American people are now finding out that their family might actually qualify for government help to buy health insurance, but they're not going to receive the help. Instead, individuals enrolled in the federally run exchanges could be forced to buy health insurance that absolutely they cannot afford. Not only might this law cause individuals to spend money that they don't have, the law may also offer tax-funded subsidies to people who don't actually need it. Let me repeat that. The law may actually offer tax-funded subsidies to people who don't actually need it. At a time when our country can hardly afford to spend money we don't have, Medicare's chief actuary, Richard Foster, exposed yet another glitch in the president's health care law. The law allows approximately 3 million middle-class early retirees to qualify for Medicaid. Well, Medicaid is a safety net program designed to help low-income Americans. Here's how this one works. The health care law defines how the federal government will set an individual's Medicaid eligibility. The calculations are all based on income. Here's the glitch. The health care law excludes a large part of an individual's Social Security income from that calculation. Well, today, federal low-income assistance programs are required to count Social Security benefits as part of an individual's income. Thanks to the health care law, early retirees earning up to $58,840 a year could now be eligible for Medicaid. Here's what Mr. Foster said in an Associated Press article. He said, "I don't generally comment on the pros or cons of policy, but that just doesn't make sense." This is the chief actuary of Medicare. "I don't generally comment on," he says, "on the pros or cons of policy, but that just doesn't make sense." Well, Mr. President, I agree. That's why I've co-sponsored legislation introduced by Senator Mike Enzi closing this loophole. Senator Enzi's bill, S. 1376, changes the health care law's subsidy eligibility calculation to include all non-taxable Social Security income. The Congressional Budget Office and the Joint Committee on Taxation estimate that if we enacted Senator Enzi's bill, we will save the federal government and the American people about $13 billion. The Senate should immediately take up S. 1376 and pass it. This is $13 billion we can save right now, today. Let's show the American people that when we see our country spending money that it shouldn't, that we will take a stand collectively as a Senate and stop it. Now, these two examples, inevitably beg the question, what next? Clearly, the self-described, quote, most transparent administration in history, close quote, has a lot of explaining to do. I just don't believe that my friends on the other side of the aisle, who wrote this very flawed health care law, and they did it behind closed doors, I just don't think that they know what they are doing when they wrote these provisions. Now, how do I know that? Well, if they understood how devastating their policies would be, I think they might have had second thoughts. How many more disruptive, ticking time bombs are there lurking in this law and in the regulations that still haven't been written about this health care law that was signed a year and a half ago? We don't know. We don't know because many of the provisions don't even go into effect until the year 2014 or later. Well, as a physician who's practiced medicine a long time, cared for patients all around the state of Wyoming, been active in the Wyoming health fairs, bringing low-cost health screening to people all around the Cowboy State, I intend to fight each and every day in the Senate to make sure the American people will not have to find out what kind of additional ticking time bombs there are in the health care law. That's because I am more committed than ever to to repeal the health care law and replace it with patient-centered care. Replace it with health care reforms that help American families get the care they need from the doctor that they want at a price they can afford. Thank you, Mr. President. I yield the floor. Suggest the absence of a quorum.